Our eyes are the windows to the world, which may be why we often take healthy eyes for granted. But fortunately, modern procedures and good doctors can do a lot to help us keep our vision should a problem occur. Dr. Wesley Harnish from the Eye Surgical and Medical Center in Westerville joining me now with some advice for good eye health. Hi, how are you doing, Dr. Harnish?
Very well, how are you?
I'm doing great. You know, you have been in the Central Ohio community for quite some time. You're an OSU alum, I hear, so congrats on the big game. But how long have you been practicing yourself?
30 years.
30 years. So you've probably seen a lot of issues come and go with people's vision.
We do. I practice general ophthalmology, so we're in almost all of the areas involving the eye.
Okay, so today we're going to focus on cataracts. You brought, obviously, this eye that's sitting right here staring at me. But what is the cataract? What exactly is that?
A cataract is the lens of the eye, which has become cloudy. And the lens of the eye lives back here inside the eye, behind the cornea and behind the colored part of the eye. It's just sits here just behind the iris or the colored part of the eye. And that's what becomes cloudy and causes people to have poor vision as they age.
And is that something that only happens as people get older? Is anybody apt to get them, or how does it happen?
If we live long enough, virtually 100% of us will get a cataract.
Really?
And the stages of cataract are several. As we reach age about 43, the lens becomes stiff because it grows like an onion and adds layers to the outside. So most of us, not most of us, virtually all of us need reading glasses or bifocals when we hit about 43, and that's the beginning stages of the lens changing. As we get to our late 60s, most of us then begin having some opacity or some blurriness to the lens.
Okay, and what happens if somebody doesn't seek treatment? I know a lot of people kind of are in denial when they start to age about a lot of things. Can it get worse?
They do. They progressively get more cloudy, and the vision becomes blurrier and blurrier. And we do have many patients that come in and say, well, I really am not bothered by my blurriness, but we know that if we wait long enough, they'll be back.
Now, as far as treatment, there is a new procedure that you want to talk about in treating cataracts, right? There
is. We've been taking cataracts out for many years, and we have been able to do it very well with hand instruments. But now we have lasers that can help us do this, and the lasers are able to be more gentle on the eye and slightly more accurate than what we can do with our hands. So the laser is a big step forward in cataract surgery.
And how is that different as far as recovery? Does that have any effect on that?
It does make a difference because the gentler you are on an eye, the quicker it can recover.
Do people avoid having to go in and talk to you, you think, until it's too late because they are trying to just say, it's not happening to me?
Well, fortunately, it's almost never too late.
Okay.
We can almost always take care of a cataract very, very well. We are slightly able to do it in a way that is gentler on the eye when it's not very advanced. But fortunately, we almost never get in a situation where we can't take care of it at all.
Okay, that's good news. Is there anything we can do to prevent it?
We can't actually prevent the cataract from developing, but what we can do is have regular checkups so that we can take care of it at the most optimum time for the given individual. So for instance, a person who is still working in the professional field and needs to do a lot of things with their eyes which are very detailed may need to have work done sooner. A very elderly person who maybe doesn't drive a car anymore may be able to postpone work a little bit longer. So we can tailor the time that we do a procedure according to a person's lifestyle.
Okay, and you offer from the regular checkup all the way to the cataracts treatment, right, at your center?
We do, and we're proud that we offer much beyond cataract surgery. The other diseases of the eye, such as macular degeneration and glaucoma and so forth, we take care of that. So we try to be a service that takes care of all the components of eye care.
All right, Dr. Harnish, thank you so much for joining us today.